Welcome back to Ask the Nurse Navigator live on the Live Lung Cancer Network. My name is Katie Brown, and we are chatting with Nurse Navigator Angie Swaim today. We are diving into the journey. We are talking about the things that are life-changing, things that, reveal incredible strength, and all of the things along the lung cancer journey that we could fit into 45 minutes. Okay. Whether you're newly diagnosed, whether you're a caregiver looking for answers, or an advocate ready to make an impact, this discussion is going to be a roadmap to understanding what might lie ahead for someone who's been diagnosed with lung cancer. If you're watching the replay and you're not watching live and you have questions, email them to us. We'll make sure to get them to our nurse navigators. You can email them to katie@livelung.org. And also remember that this discussion is informative only, and it's not intended to be medical advice. So please discuss everything you see or hear on the internet with your personal medical team. You're going to hear that from me every single time. So now let's unpack as much of this as we can. Angie, welcome back. How are you today?
I'm doing well. I hope everyone else is. Thank you again for inviting me to the forum to talk about lung cancer.
Absolutely, absolutely. A patient's journey it can be so different depending on, what health system you're in, or what your culture is, or what your type of diagnosis is. But that feeling of when you're first diagnosed is very similar. What do you think is probably, in your opinion, the most important thing that someone who's been newly diagnosed should know as they're starting?
One of the biggest things that is very important to know is there are two different types of lung cancer, and knowing the difference in those cell types can make a big difference in your understanding of your treatment. Non-small cell lung cancer is the lesser of the two evils, so to speak, because it's less aggressive than small cell lung cancer. Small cell lung cancer tends to be more aggressive, but we treat it more aggressively because it tends to respond more quickly to treatment. So knowing those differences can make such a difference in the way you understand your treatment. Understanding staging, discussing staging with the doctors is so important. People have sometimes a false understanding, and I think sometimes doctors don't quite tell them exactly how it's staged, or they think the patient might not be health literate enough to understand it. But knowing what stage you are and understanding that treatment for that stage and the differences in treating non-small cell versus small cell, those are all such important questions. And I tell folks, keep a notebook, wake up at 2 a.m, have a question that pops in your brain, write it down in a notebook. If you're driving in the car and you're thinking about something, when you get to a stopping place, jot it down. It's really important to write those questions down so you feel like you are part of your own care team. You're your best advocate.
That's great advice. Absolutely. So when you're thrust into that whole cancer experience, as a patient myself, you look for things that you can control, right? You look for things that maybe you have ownership of, or that you can take control of. And some of that looks like physical activity or nutrition or dietary changes. Last month, we had a question come in through email asking about whether or not, artificial food dyes were hurting them because, they had cancer and they're trying to stay as healthy as they could, or things that were non-organic, things like that. Where do they find information on something like that? And is that something that they should be focused on when they're newly diagnosed?
I think with any patient, focusing on balanced nutrition. There's a reason why the food pyramid has been around since we were little kids and talked about it in health class. Balanced nutrition, not going into extreme diets. You have patients that might do extreme juicing. Well, then you're missing very important nutrition from protein. Keto diet, terrible idea for someone going through lung cancer treatment. They need protein, certainly, but they need hydration. They need nutrients from fresh fruits, fresh vegetables, and yes, starches are a part of that food pyramid. It's very important to stay hydrated. We always recommend 6 to 8 glasses of water a day, unless, of course, you're on some type of water restriction. Um, those are important things, not going to any extremes. I always tell my patients if there is something you're not sure of, for instance, vitamins, nutritional supplements, before you start anything new, you should discuss it because some of those vitamins and supplements can actually impact how chemo is absorbed. So those are things to keep in mind. I certainly encourage anyone to eat healthy, and our dietitians are a wonderful resource for our patients. I hope all of you guys out there have access to the dietitians like we do for our patients. But it is important, to keep that dietitian on board throughout treatment. And I try to have my dietitian touch base in the initial starting point of their cancer journey.
I know not everybody knows about dietitians. So, if you guys are listening to this and you haven't talked to one in your health system, ask about it. Ask if you have, nutrition services or dietary counseling, something in your system. Ask. But that's a great idea. Also, in terms of treatment side effects, jumping on your answer about, the treatment side effects that, you might have skin issues or you might feel different things. Do you recommend that a patient try over-the-counter medications to address side effects, or who do they talk to when they're having these types of side effects?
So that's a really good question. Whenever we have a patient, new patient workup, they come in, the doctor has decided what they're going to treat the cancer with, what treatment is being prescribed. Then we sit down with that patient to do what we call a chemotherapy consent. And that's when we go over their treatment plan. If they get chemotherapy, immunotherapy, or if they're getting targeted therapy, it really depends on the type of cancer you have and your biomarkers. We focus on all the possible, not probable, and it's important to hear the word possible toxicities that you may have. So, yes, I have folks who take treatment and they still are able to tolerate treatment, work full time, continue raising their kids, play with their grandkids. There's so many different treatments out there now, and it's important to know the toxicities of each of these treatments. Fatigue, I would have to say that is number one, just about across the board, even if it's immunotherapy versus chemo, it's almost always, you have fatigue. It can be mild to moderate. Of course, it can be severe in some folks. Everybody has a different response to treatment. Appetite's important. You may or may not have, excuse me, nausea or vomiting. We used to think of chemo causing this mass vomiting and always losing your hair, and that is not the case. So looking at, what is out there if you do have nausea or vomiting, certainly having antiemetic medications, Phenergan, Zofran, those are two of the big ones that we use. Low dose Ativan may be something. Also, appetite, you may lose your appetite or your taste buds will definitely change when getting chemotherapy or immunotherapy. So when you're used to that big yummy cheeseburger, it's not going to taste the same. And I always tell patients, maybe while you're doing treatment, think about avoiding your favorites and trying something different because you're not used to how it tastes. You kind of psych yourself out, and that sounds kind of funny to think about, but it actually works really well for our patients. lung cancer patients are notoriously short of breath, not necessarily from smoking, certainly, but the disease process until the chemo or radiation or immunotherapy has had time to get a response from or get a response from the cancer rather and shrink some of that disease process, you can have a lot of breathing issues, a lot of coughing issues that can be so straining to a patient because they're coughing, it's keeping them up at night. They're, wanting to do their usual activities, but just that chronic cough can be difficult. There are medications that we can prescribe to help with that. Just like we can prescribe, for nausea. There's actually medications you can prescribe for fatigue. I always tell folks to check out our symptom management clinic because they are fabulous to help with palliating symptoms related to chemotherapy. Pain is a big one for some of my patients. It's not with all lung cancer. Certainly, lung cancer patients can go with no pain whatsoever. But for those that might have effects in the bone, or, it might be a little more widespread, that pain can be life altering. Quality of life is everything to any cancer patient. And I always tell, my patients, please let me connect you with our palliative care symptom management team. Let's make sure you're out of pain. We want you to have the best quality of life for ever, for as long as you live, for as long as you're battling cancer, and then even after the battle. So it's really important to make sure you report any of those toxicities and side effects you're having. Know what to look for, know what to report. Fever, absolutely. Anything over 100.4 degrees Fahrenheit should be reported when you're getting some type of chemo or immunotherapy. So these things are important, and it's information overload when you do the consent for chemotherapy. You're going to hear half of it, you'll remember maybe 10% of it. So keep all the information somewhere where you can just grab it if you need to, and communicate with your navigator, with your healthcare team. Don't ever be afraid to tell someone what you're dealing with. It is so important.
It is. That is great, great advice. So we're going down the pathway, right? And we did newly diagnosis. Last time we talked about multidisciplinary care team. Talked about some treatment tips and side effects. But let's talk about the psychosocial stuff, the mental health. Is that something that a nurse navigator deals with if you have a patient that's struggling with mental health and depression and maybe just the confusion of everything of being out of control?
Absolutely. So we kind of tease each other because we say that we overlap each other. Social worker overlaps the resources coordinator, who overlaps the counselor, the chaplain, the nurse navigator. And it just goes to show you that the multidisciplinary team is very necessary to help provide the best quality of life for that patient. It's terrifying. No one wants to hear the C word. No one has ever heard it and not felt total anxiety, complete fear. Those are normal responses. Anger, being angry. It is okay to be angry and to admit to that anger. I'll have folks, they do not want to tell the doctor how they're feeling, whether it's angry, scared, anxious. They don't want to tell the doctor because, well, if I tell the doctor how I'm feeling, they may not want to treat me. you know, they don't want to talk about side effects, and they don't want to talk about the emotional or mental impact it's having. And that's a lot of times, who will they talk to? The navigator. They'll talk to the dietitian. They'll talk to our chaplain, because our chaplain just goes in there. She's just a source of comfort. She's not there to preach. She'll pray with you if you want, but just a source of comfort. They'll tell the counselors, but so often patients won't admit to the impact, the emotional and mental impact that cancer and treatment is having. Making sure a patient is connected with those support services, it's crucial. We have a Living with Lung Cancer support group because anybody who is fighting lung cancer is living with it. You're alive, you are living, you are, you know, doing your very best to stay on top of the treatment and the disease process. And so often we have such a great time and support group because if you want to share your story or journey, that's fine. But we all know why we're here. We're affected and impacted by lung cancer. So we try to do fun stuff, relaxing things, things that make us laugh, things that make us act silly. And it is so refreshing to the patients that they get to come in there and for that hour, hour and a half, just forget they have cancer because they all can relate to each other. But it's such good medicine. Laughter is such good medicine. And when you're scared, you're, impacted by cancer and you're scared, you're afraid to laugh. You feel like you have nothing to laugh about. I've had patients that said they felt guilty to laugh or have fun because, well, I shouldn't be having a good time or feeling good about something when my family's impacted by, my diagnosis. And that's no one should be, made to feel that way, so to speak. So it's really important to keep a patient connected to those social networks, support groups, and their family as well. Those caregivers are going through it just as much as those patients.
Absolutely. I see a lot of times in our network where patients or someone who's newly diagnosed tend to retreat. You
Mhm.
know, they
Exactly.
retreat, they hide, they feel like they don't have anything to offer because
Right.
they're not survivors yet. I'd say you're a survivor from the moment of diagnosis.
Absolutely.
Um,
Absolutely.
and yes, and living with it, you're surviving it, all that good stuff. But whatever you call it, we have to connect with those patients who are retreating and isolating because, they don't have to go through this alone.
Right. It's very important. So often we don't want to ask for help, but you have to ask for help sometimes. And I tell my patients, they don't like to lean on their kids or lean on their loved ones or neighbors or church friends. But I look at them and I said, well, if your neighbor or daughter or son or mom needed you, if they were the one that had cancer, wouldn't you be there for them? So I try to make patients understand that when they lean on that loved one or their caregiver or friend, whomever it may be in their social circle, you are giving them a gift. You're allowing that person to walk a journey with you. You're allowing them to share in the fight that is lung cancer. And so I try to make them see it a little differently. So it gives them permission to help set boundaries and delegate, tasks when they so often need that extra support when going through something like this.
That's a great point. Absolutely. And that piggybacks on another thing that we see quite often, people who are not used to asking for help.
Mhm.
Once they're diagnosed, there's that internal struggle. I'm independent, I can do it myself, and this is not a normal situation.
Right, absolutely. It's not. It's
So,
guilt. It's a lot of guilt, and it is very difficult for patients and especially smokers. And I hate the stigma of smoking being the only way someone gets lung cancer because they feel guilty, like they did it to themselves. And I've actually had family members scold someone for, for getting lung cancer, blaming it all on smoking or exposure. you No one asked for cancer, and that is what I just try to make people understand. No one should feel guilty about getting cancer. No one should make you feel guilty for getting cancer. It is something that is so far out of our control. I would love to see cancer cured in my lifetime, but we all know that it is constantly changing. So I think those are important things to make sure patients are reassured and that they feel like they can ask for things, ask for help, feel supported, and not be made to feel guilty or like they have to retreat. They should be able to enjoy life even though they're fighting a possibly life-limiting diagnosis.
absolutely. I love that. Yes, absolutely. Okay, so this is a little different. We're gonna turn a little bit down this way, and talk about the environment and safety. Now, the one thing, not one thing, but a thing that the pandemic taught us was that immunocompromised people are at risk for illnesses, right?
Absolutely.
And when you have cancer and you're in treatment, you may be immune compromised. So what kind of advice do you give someone like that? Someone who, may be a grandparent and has grandkids or has, younger kids in school around a lot of people, or maybe works in a very busy environment.
That's a great question. I alluded earlier to the fact that we tell our patients, one of the biggest things to do is if you spike a temp over 100.4, you need to report it because someone going through therapy, that could be a sign of infection. And it could also mean if your white cells are really low, then you don't have the infection fighting cells you need. And it can be a very serious matter for someone whose system is immunocompromised who's getting treatment. Watching infection prevention, like you said, kids, I always say they're petri dishes because they are. So kids are terrible. They sneeze in their hand, they don't wash their hands. There's so many things. So it is so important, keeping Purell, keeping antibacterial soap. Sure, don't stop visiting your friends or your church members or your children or grandchildren, but make them wash their hands. I always say, as soon as you walk in the door, wash your hands. You see healthcare workers hit the little Purell pump or wash your hands. It's the same for kids. It's the same for grandkids or for sisters, brothers. That's really important. Just being cognizant of exposure. I tell patients, especially going through treatment, if, don't stop doing your normal activities, but if you're cutting the grass, wear a mask. Think about you're breathing all that in. The pollen's horrible right now here in North Carolina. For those of you who live in this area, I tell folks, while it's bad, wear a mask. Protect your lungs to the best of your ability. You can't go wrong protecting yourself. Certainly, smoking has an impact. We know that environmental fog, smog, those things, of course, have an impact. Stopping smoking can make a difference with treatment, lowers the percentage of recurrence for cancers coming back. Stopping smoking or very, very minimal smoking, it can increase the ability for your treatment to work. You're not getting 100% of that radiation or that chemotherapy or that immunotherapy if you're smoking. I have proof of it. I can share flyers, I can share booklets. I am a smoking cessation counselor, and doctors don't tell you those things. They just say, oh, quit smoking. But tell me why I need to quit and how it impacts my future and my well-being. Because it's so hard to give up something that's a comfort when you have been given this life-limiting diagnosis. And you're going to take one more thing away from me. And sometimes lung cancer patients will say, well, I've already got lung cancer. Why should I quit? And I'm like, well, this is why you should quit. But the choice is theirs, always. But making those significant changes with infection precautions and just being more cognizant of your surroundings, masking, like we said during COVID, we didn't know what anybody looked like anymore because we lived in a mask. I think those are really important things. I tell folks who are on oral therapies, oral targeted therapies, keep your medication out of the reach of children. Unfortunately, we've seen situations where mom turned her back for a minute and that 3-year-old grabbed that chemotherapy pill and took it. That is poisonous to a child. That is huge. And, it is terrifying to think the impact it could have on a little child. It's dosed for an adult, it's not dosed for a little child. So those things are really important. And a lot of times, you're just not used to thinking about it, keeping those things out of the reach of kids, just different things that can just help keep you safe, but your family safe as well.
Those are great tips. Absolutely great tips. And we can go back to maybe being newly diagnosed and someone who has comorbidities and maybe multiple medications, a medication box, a reminder, those types of things would help as well as, chemo proofing your home, baby proofing your
Yes,
home. Yeah.
absolutely.
Yeah, I think that's great. Yeah, those are great ideas. What about like support groups, right? Are there support groups that patients can go to where they can share maybe difficulties with, quitting smoking?
Sure. The American Lung Association and the Duke Tobacco Free smoking cessation programs, I did certifications through both of those. They focus a little differently on the particulars of smoking cessation. The American Lung Association has a great program. It's a little lengthy, but for someone who is just steadfast, ready to quit, it's a fun program. It's a great program. It works in a community type group setting. It's just a good focus on why you're smoking, how to remove triggers that make you want to smoke. My dad got up in the morning and he grabbed his Bible, his cup of coffee, and his cigarette, but those were his triggers.
Yeah.
So, socialization. My mom would smoke, and both my parents are not smokers anymore. But my mother would smoke with a friend at work or go out at lunch and smoke. So trying to see what triggers you don't want to smoke and trying to change those triggers or do something in lieu of that. So that's one of the Freedom from Smoking programs through the American Lung Association. Great program. The American Cardiology Association, they also have a program that's a little different as well because it's not so much lung cancer focused. It's more focused on the heart and the impacts of smoking on the heart and cardiovascular system. The program through Duke that I mentioned with tobacco cessation, it focuses more on medications and medication support, pharmaceutical support, whether it's over the counter or prescribed. So they've got a great program. Yes, they have support groups. Just about anywhere you go where you get support, there should be some type of smoking cessation program. And in a community-based setting, it is great because you've got a buddy system. You hear about Alcoholics Anonymous having a buddy to answer to. This is very much the same way. They want you to answer to your buddy, a buddy system that, well, yeah, I smoked and I shouldn't have, but you have to answer to each other. Or if you were able to go so long without smoking, then you celebrate each other. So anywhere there is a cancer center with treatment, there should be some provision of smoking cessation. And I would always tell patients to ask for that.
Now, what about those patients who have lung cancer who've never smoked?
That's a great question too. Interestingly enough, whenever someone says the words lung cancer, immediately someone says, "Wow, you smoked? Well, I didn't know you smoked." They immediately assume that it was lung cancer caused by smoking. Not the case. Nearly 20% of lung cancers are not related to smoking. That number has increased just in the past 5 years, guys. And nearly 20% that are never smokers, more women than men are affected by lung cancer who have not smoked. There and again, those strange statistics. We are seeing that because of mutations. If you're familiar with the word biomarkers, molecular testing, we are seeing mutations that went in there and changed your DNA. It made an alteration in your cells. So your cells that should naturally get rid of old cells or useless cells, instead of your body getting rid of those cells, something turned off your immune system. That mutation affected your immune system, and it's not able to get rid of cells that could turn into cancer. We have cells that our body sloughs cells internally and externally, and your body, something goes in there and just causes a mutation. And so your body cannot keep up with those cancer cells. Instead, they take over. So for folks who have a mutation or an alteration in their DNA, it's important to meet with other folks who are in that same boat. The KRAS kickers is one of those support groups that everyone with the KRAS gene. It's good to find those people. We're
Let's a
seeing
shout out to the BRAF group.
Yes, BRAF group.
Yeah.
Absolutely. That was my next one. And it's interesting too. We didn't always see a genetic connection. We are seeing more of the BRCA gene and the HER2 gene in some of our lung cancer patients. Notoriously, that was affiliated with your breast, ovarian, prostate. Now we're seeing it. So some of those folks have already done genetic testing. And if we know that they share those genetics, it's good to get them connected with each other. People, the more they share, the more common interest they have with another patient, the less they're going to feel alone. And that is so important for a patient to never feel alone. Everyone deserves that support.
Absolutely. So I think the key point here is whether you have a smoking history or whether you don't have a smoking history, there is community for you.
Absolutely. Absolutely.
Don't have to go through this alone. Absolutely. Yes, yes, yes. So let me see. Let me get to some questions. I've loved our discussion today. So this says, can you explain my biopsy or scan results in plain language? So I'm not going to show you a biopsy or a scan, but and I'm the patient. I have this. Maybe I've looked on my portal. We do that all the time.
Yep, that's
And
we do. We
I
do.
I printed off my report and I'm looking at it and I don't understand it. What do I do? Do I go to Google? Do I go to my navigator? How do I understand? Because my doctor's only going to see me for about 5 minutes. How am I going to understand these test results?
That's a great question. Number one, guys, stay off of Google. That's all I want to say. That's rule number one. And I do, as part of being a lung navigator, I am one of the nurses who reads incidental findings. Say you just incidentally went in there for a chest x-ray, or, during COVID, we had folks coming in there looking at their lungs and you found a mass or you found nodules. So those are some of the things I do with reading scans with my providers, of course, and connecting patients with the necessary providers they need to see to complete their workup and see if they have lung cancer. So looking at these scans, you can certainly go on there and look at scans, and they're scary, but you're going to see the size of nodules or the size of masses or the size of lesions. All those are words that describe lung cancer. It's hard to understand the difference in nodules, lesions, and masses unless you have a little bit of healthcare inclination or a little bit of healthcare experience. Those are things that let you know, okay, hey, there's something suspicious in there. Doesn't necessarily mean it's cancer, but right out of the gate, if something's suspicious, it warrants further evaluation. Looking at the biopsies, that sounds a little tricky for people. Surgical biopsy certainly is different. When you have surgery, they will remove a section of the lung, or they may remove a lobe of the lung, but they also check a certain amount of nodes to see if they have what we call negative margins or positive margins. All that is to say, if everything is negative, that's great. We know that that means there's not cancer in that particular node. If you see positive margins, it doesn't mean that all hope is lost. It means that that will impact how you're treated after surgery. Not everyone needs treatment after surgery, but those things have changed, not to get into the specifics of adjuvant treatment. As far as looking at biopsies for small cell versus non-small cell, it impacts treatment, seeing that, understanding the differences. But I say talk to your provider, certainly reach out to your nurse navigator, because first and foremost, my job is to advocate and educate my patient. Talking to the nurses that work with the providers, a nurse always has more time to spend with you than your provider. It's busy, and the bigger the cancer center, and if it's an academic setting, especially, it's going to be so busy. But when you're sitting there, looking at that, stay off of Google, because you're going to get some bad advice off of Google, and I can tell you that. But make sure you've got a sound, solid source to find information from.
So we are having Physical Wellness with Lori in the Lung Cancer Network, and she's going to be talking about physical activity and physical wellness. But the question that I have is, am I able to be physically active? Can I exercise during treatment?
Absolutely. And, we encourage exercise. Now, the amount of exercise you may feel like committing yourself to it's different for everybody. Like I said before, I have patients that are in their 30s, 40s, 50s. They're still raising kids. They're working, they're raising kids. I had a lady who was adamant that even, during treatment, she would take that one day during the week off to do her chemo, and all the other time she was, in the office, well, that one day she is sitting there taking chemo, she is on her keyboard trying to work from home. And then she'd leave, go pick up her kids. They played ball. She would go out there and walk the track while her kids are playing ball. Any kind of activity that keeps you healthy, that you can tolerate, it helps with fatigue. It helps with our emotional state of health. It impacts our ability to tolerate treatment. And you don't have to go out and run a marathon, certainly nothing like that. Some of the things I hear my patients love is swimming. They love yoga. They love walks. Taking that dog out, the dog can get some exercise in addition to you. But those are things that patients should not feel like they have to give up, especially your marathon runners, especially your cyclists. They feel like, oh my gosh, I've got cancer. I got to shut everything down. No, you might have a few speed bumps until you can get to a point where you can tolerate some of those same activities. Part of it is giving yourself some grace and having some patience, but no one should have to give up their routines or their exercising.
So we are coming towards the end of our time on Facebook Live, and I've been looking at some of the questions that were sent in email, but I think this one is asked by a lot of patients. I've just been diagnosed with lung
Okay.
cancer. What should I be doing right now to help myself live longer?
That's a nice question. Number one, think about the impact it has on you in respect to your family. I think ahead of time about things, staying connected with family. You can tell who you want to or share what you want with them, but you may very well need their help. Share some of these things you're going through. Don't feel like you have to do it alone. Think about how you can stay healthy and stay aware of what's going on, but still keep up with your normal routine while you're going through diagnosis. The folks I see that work, that continue their normal activities, they still pick up their grandkids. They still, go out and do things with their friends or family. Keeping that sense of normalcy gives you the control that cancer would otherwise take from you. So try to stick to your normal routine, which sounds insane when you're trying to go through workup for possibly having lung cancer. Reaching out to folks, you seeing who you want to allow into your life to know what's going on, but who can help you, sticking to, like I said, your routine, staying well hydrated because you're kind of preparing your body to start that treatment. Those are things I think about. I know that first and foremost, a lot of my folks, and I say this from a mom point of view because I've got one going to college and one in college. How is my financial state of being going to affect and impact my family? So those are things, connecting people with a financial counselor even before they start treatment. I have a lady that just got diagnosed, and before she would even talk about the chemo, she's like, I gotta talk a little bit more about how this can impact my family. I don't want to leave them with nothing if I were to lose my battle. Thinking about those things. Transportation is huge. I do have folks that do not have a lot of resources, and so that's what I said, thinking about who am I going to invite in to know my business and be able to share this journey with me, who might be able to help me, thinking about those small things. But it is so easy to get so overwhelmed. I always feel like when you have someone that is going through all this with you. You know, my kids and my husband would be right there, but having someone who can kind of help you through all this, you know, two sets of ears, two sets of eyes when you go to the doctor. And those are things I think patients should think about before or as they're going through workup. Make sure someone goes with you. You know, it is so important. If you've got someone you trust, make sure someone goes with you.
That's such good advice. I mean, personally, I know that I don't remember half
Right.
of what the doctor's telling me if I'm alone and I'm in that headspace. So it's a great idea if you can to have
Right,
somebody go with
exactly.
you.
Nurse navigators, I will say I've sat in many a physician office with a patient who did not have someone. You know, they might have come by Uber, taxi, and they come in there and they're like, what am I gonna do? I live here alone, or my husband passed away, or, you know, a lot of military people might have moved around a lot, may not have any family in this particular area. There's lots and lots of reasons why you may not have a loved one or, you know, someone to go through this journey with you. And I'll just simply say, you know what? That's part of my job as a navigator. I'm going to sit in there with you. And what's funny is the patients are like, well, I'd rather have you than my family member because you'll know more about what the doctors talk about than they will. So you get tickled at those things, but they appreciate the navigator sitting in there with them so much. And so they're hearing about a third maybe of what the doctor says, not even half probably, and they won't remember a lot of it. So as a navigator, I try to jot down notes and questions, and I really just walk that journey with them if they don't have someone that can come in there with them. That's part of what I do as well as a navigator.
Right. And it's so important. If they're alone, they can build their team. They can
Right.
build support network.
Absolutely.
Yes,
Absolutely.
absolutely. And the navigator can show you how.
Absolutely. Well, it's a team. It's a huge team. Not just the support services, but you know, it's not just a nurse or a doctor. It is a medical oncologist, radiation oncologist, a pulmonologist. And then you got to think about what goes on behind the scenes. Well, you have a radiologist that read your scan that alerted us to finding something suspicious. But that pathologist is the one that was able to diagnose it. So people don't understand all the background of the whole multidisciplinary team. So it's not just one doctor doing all the work and all the prescribing of the treatment. You have an entire team behind the scenes that is helping regulate your treatment plan that is right for your disease process based on what cancer, which diagnosis of lung, if you have biomarkers and staging. But this entire team is making those decisions with you. So you definitely, as a patient, you're never alone. You may not see all the background people, but we are all there very much active in the patient's well-being.
I love that. I love that. And I know your patients love that too.
Mm.
This is a great time to end our discussion, but I want to remind everybody that the next Ask the Nurse Navigator is going to be Monday, May 5th, and that one's going to be with Morgan. She is going to be talking about like your new normal and transformation and all those things. Once she gets a title, we'll get that out there and we'll share that with you guys. Can't wait to talk to her about that. And if you have questions about any of that, pop them in the chat or email me at katie@livelung.org. We've had a great time. Angie, thanks for joining us
Thank you
again.
guys. It's nice to see you again, and thank you for letting me be a part of this discussion.